If you've been watching any of my previous interviews, then you may or may not have noticed that some people have mentioned Scrambler therapy. So Scrambler therapy is considered experimental. I don't know all of the ins and outs, and I'm no expert at it, but I did try it, and I wanted to share my experience. So for those who are unfamiliar with Scrambler therapy, I believe it originally was invented in Italy, and someone in the United States, his name is Dr. D'Amato, he's located in Florida. He is the first doctor who brought it to the United States. He studied directly under the doctor in Italy. He got the Calamar Scrambler machine, and he brought it to the United States, and since then more and more providers are learning about Scrambler therapy. So Scrambler therapy, so far I'm waiting to hear back if my insurance is going to reimburse, but as of right now I'm going to say it is not covered by insurance. We shall see. The provider I saw, I highly recommend her. Her name is Dovie McVean. She is located in Hurst, Texas, and she was wonderful. She's been a physician's assistant for over 20 or 25 years for an orthopedic surgeon. And I hope to have her one day on this podcast to share her journey of how she discovered Scrambler and why she decided to try it. I won't tell her story for her, but her story is very inspirational of why she got into the field of Scrambler. But basically what Scrambler is, I don't have the pads with me anymore. I haven't needed them, but they're big shaped pads that have an adhesive, and you stick them in different places that are near your pain, or as near as you can get, but not on it. And it sends little electrical pulses. It feels different for different people. For me, one day it felt like the static on a TV, or another day it just felt really relaxing and peaceful. It was kind of a reliever for me, but you just kind of sit there and just relax. Maybe read a book. My sessions were 45 to 55 minutes long, and each session for the first week was 200, and then for the second week it was 300. I did a total of 10 sessions where I went Monday through Friday, a break on Saturday, Sunday, and then Monday through Friday again. My experience, I can't say my experience with CRPS is different because everyone's experience is different, but mine isn't unique in the fact that prior to Scrambler, I've been working a lot on reducing my symptoms. And so whenever I started Scrambler, I'm not in constant pain. I'm not in a constant flare-up when I'm at rest. And so it was harder for me to tell whether or not it was helping. There were some moments where I was like, yes, absolutely it's helping. Like my range of motion is 99% versus before it was 70%. But then there were other days where my range of motion was not at 99%. So each day was a little bit different. And then with the pain, I eventually was trying to cause a flare-up because I wanted to see, okay, once I put on the pads, does the flare-up go away? I guess the nice thing is whenever I was trying to put myself in a flare-up, I would walk around the parking lot several days. Eventually, I started doing a light jog, and I did cause a flare-up, but the flare-up didn't last long enough. Once I went to the resting position, the flare-up went away. So for me, I wasn't able to directly say, as when I put them on, like, oh yeah, the pain is completely 100% gone. Because when I was at rest, even after I caused a flare-up, it went away by the time I was hooked up on the machine. So I will say that prior to Scrambler, I was living at about a daily pain level of 3. I can confidently say since then I'm at a 1. I think immediately following Scrambler, I was at a 2. And then since then, I've been continuing to do the other things I was already doing of meditation and slower living and physical therapy. And I also had a couple more nerve blocks. And so I think it's just like with anyone else you'll probably hear from. It hasn't been like this is the one thing. There may be a few stories that said this is the one thing that's helped me go into remission or the most relief. But for me, it's been a combination of things. It wasn't like Scrambler is the miracle answer for me. Scrambler is what I need. It's just another piece of the puzzle that I add on to my daily routine of physical therapy and supplements. So I did 10 sessions. I haven't needed to go back since. I am confident in saying that Scrambler brought my pain from a 3 to a 2. I do think going from a 2 to a 1 was more connected to physical therapy and the nerve blocks. But with that said, the Scrambler allowed me to have more confidence to continue lightly pushing myself. I know where my limits are, so lightly pushing myself further in physical therapy. So Scrambler was a wonderful experience, and I highly recommend doing it. It is beneficial no matter where you are on the pain scale. I've heard some wonderful stories. There is a Facebook group dedicated to people who are either researching it or have done it and are open to sharing their experience with it. And I will continue interviewing people who have had success with Scrambler. That Facebook group is called Scrambler Therapy Chat, and I'll also put a link to a list of providers who provide Scrambler. If you're in the DFW, I highly recommend going to see Dovie. She was wonderful. And yeah, it's a pretty simple experience, pretty basic experience. You go in, you just relax. She has a sound machine if you need some help relaxing, or if you like to chat, she will chat with you. She would sit in a lot of times and I would chat with her. And she'll work with you on, you may have to move the pads around. There were a lot of days where I had to move the pads around a lot. What worked one day did not work for another, and it would hurt. It felt like little ant bites or fire ant bites. So there were some days where I was just constantly moving the entire hour. It's like, oh, okay, that's good. Wait a couple minutes. Oh, nope, that's not good anymore. Okay, that's good. So sometimes she would just stay in the room with me the whole time. But I highly recommend trying it if you can. To be determined on whether or not insurance will reimburse me. I also forgot to mention something else that was super helpful and unexpected. Is after I did my Scrambler therapy sessions, and Dovie noted that I probably have tendonitis in my ankle and in my knee, or I guess ankle/foot. And so every other day I swapped out doing something called MLS laser therapy. And boy, I was skeptical, but it has helped a lot. My knee pain is almost non-existent now, where before it was like I was working with my physical therapist to start walking on the treadmill. And I said, I can't walk, not because of the CRPS, because my knee is hurting. And then eventually because the top of my foot is hurting, and that's not CRPS pain, that's some other type of pain. And so she noted that I should probably do MLS laser therapy, and it was like night and day difference after probably 4 or 5 sessions. My pain was almost non-existent. My pain is starting to trickle back. So in a few weeks or a few months, I'm going to try to go as long as I can without doing it again. I may try a provider that's closer to me and see, but it's quick and easy. It was 10 minutes. You just wear goggles and close your eyes. You don't want to look at the laser. And it helped me significantly with my knee and foot pain from tendonitis.